I'm joined by Senator Alice Mann to discuss her life as a legislator and the Minnesota Paid Family Medical Leave Act. Senator Mann helped champion paid leave, and Minnesotans will soon be able to take time off when they need it most to care for their loved ones. Today, we're going to ask you, Senator Mann, approximately 10 questions in about 10 minutes. Are you up for the challenge?
I'm ready. Let's do
All
it.
right, let's do this. So, the first question: if I'm at Christmas with my family and someone asks me what paid leave is, what should I tell them?
Well, you can tell them it's a program that the rest of the world has already, and we are so far behind on the 8 ball, but it's basically a program that allows family members to take time off of work, to take care of themselves, take care of a loved one, bond with a new baby without risking losing their job and their income. It's that simple.
Wow. The rest of the world has this.
The
Like, this is
entire world. We are the last industrialized country that does not offer this program,
that's remarkable.
isn't it?
It is. So, what inspired you to take the lead on this effort?
Yeah, great question. So I was in getting my master's degree in public health, and this is what I worked on for 3 years, was looking at paid leave policies around the world, looking at the paid leave policies that were in place in America. We are state number 13 to do this. And I just saw all of the data supporting this, hence the reason why the rest of the world does it. So we saw the decrease in number of poor maternal health outcomes. It's healthy for moms, both mentally and physically. It's healthy for babies. We saw decreased numbers in pneumonia and GI infections and ear infections, decreased clinic visits, decreased hospital visits. We saw decrease in preterm labor numbers. So for the health of people alone, it's an amazing program. And then we also looked at the economics of the program. So decreased need of childcare, decreased need in long-term care, both of which we are having a crisis right now. And increased employee retention. It's good for business. It's good for families. It is a wonderful program for health and economics alike.
It sounds like it checks a lot of boxes, a
Yes.
lot of boxes. So, how did your role as a doctor influence your work on this?
Well, I still do see people every single day who need time off of work. People who have just been diagnosed with cancer, people who just had a heart attack, and they cannot go back to work. And so these families go into financial struggle. They go bankrupt because people cannot, go to work, get their paycheck, and take care of their health. And we also see when you have a baby, that's one of the most vulnerable times in a family's life. And if you can't check, how are you supposed to feed that baby? And so I see the need for this program every single day that I go to work.
So, we're going to come back to paid leave, but I have a question that I am like, that's running through my mind, and I think others might be interested too. It's a little more personal.
Okay.
As a doctor, I don't want to call it junk food, but what's your favorite indulgence food?
Okay, don't tell anybody, but it's chocolate cake. Chocolate cake all the way, all day, no competition.
So it sounds like if you're gonna do it
You're
well.
do well. Yeah,
Go make those calories worth it, right?
exactly. Don't
Thank
waste
you.
your time. Yeah.
Thanks for sharing that. I had to ask. So, some people think back to the paid leave. Some people think of paid leave that it only applies to new parents. But as you know, caregivers come from different backgrounds and families, including older adults. Now, our research shows that the average caregiver in Minnesota is 50 years old. What are your thoughts on why caregivers are so important to be covered by this law?
Well, caregiving is one of those, invisible labors that it goes
Mhm.
unpaid, but really we're spending the estimate is around $8 billion in unpaid caregiving. And so it's incredibly important. I mean, imagine, you have an older parent who falls and breaks their hip. They have to go to a nursing home, or you can take some time off of work to take care of them for a couple of weeks until they literally get back on their feet. That's a huge deal. And again, for the economics of the state, for the economics of that family, that's a really important thing because it's very expensive to put people in long-term care.
Yes, we know that in our family firsthand. It is it's a cost that is mind blowing, and it just most people have no idea how expensive it
No,
is. And yeah, it I tell a lot of my friends, if you think you've saved enough for that, I will
you
guarantee you, you probably have not.
You haven't. And
You have
also
not.
the idea of imagine healing at home with your family in
Yes,
your own bed versus being with strangers in a strange place. I mean, that alone is really important for healing as well.
absolutely. So, how is this funded?
So it is a premium split between employees and employer. So for every $100 somebody makes, they pay 44 cents. Into the program. And that allows you, again, 12 weeks to take care of yourself, take care of a family member, take care of a new baby. Um, and this is generally how most states have done it. And it has worked out really, really well.
So, a corollary question to that, with that number of the average caregiver is 50 years old, will retirees who are no longer working be paid in
So,
this paid leave?
so you have to have an income in
Okay,
order to participate.
gotcha. Thank you for that clarification. Appreciate that. So, small businesses, as we both know, it is a vital force in our economy and our culture, and they have so much going on in their worlds, and everything's affecting budgets and staffing and retaining staff and all those things that small businesses are dealing with right now. How does this law think about the needs of small businesses? How are they considered in this?
Yeah, so this is huge for small businesses because historically what happens is large businesses understand the benefit of this program and so they offer it already. Small businesses
Mm,
cannot afford to do that. And so they are already not on the same level playing field as these larger businesses. They can't retain the same people, they can't attract the same talent. And so they're starting off at a very unfair advantage. This levels the playing field for small businesses. Small and
mm.
large alike can now offer this program. And so they can compete for that better, more qualified talent. So we are hearing from small businesses all over the place that this is going to be huge for them.
Awesome. And then one other question that comes to mind here for me, especially with recent news about, while this program is needed and it'll allow somebody to take times off, I'm sure there's concerns about the program being exploited by fraudsters.
Mhm.
What are the safeguards so that people can't game the system?
Yeah, so historically speaking, this program has extremely low fraud rates because there are so many guardrails in place. So we're seeing that across the other states that have implemented it, fraud generally has not been an issue because of these safeguards. So first you have to have a 7-day qualifying event. We're not talking about, oh, I feel I have a cold today, I'm a little runny nose, I'm going to take paid leave. That is not the way the program works.
Hmm.
And I always ask, can you remember the last time you could not work for 7 whole days? That is a big
It's a long time.
that's a long time. That's a big medical event or a big life event. And so you have to have documentation from a physician about what that looks like. Again, I was just diagnosed with cancer or I broke a hip or whatever it might be. And then the state also verifies that with the employer, they verify that with your medical provider, and they verify that there's not, they can see how many people are taking time off to take care of a certain person, for example. And so there are multiple checks along the way to prevent fraud in the program.
Thank you for addressing that. I am sure that feels like it's all the bases are covered on that. That's awesome. And then for those who are watching, who want to make sure this law continues to serve families across Minnesota, what can they do to help protect this law for the years to come?
Well, you can certainly talk about it to friends and family. Make sure they understand the why this is so important.
Mm.
And also write to your legislator, say, I want paid family leave to continue. I want it to be successful. I want you to support it. And so those are very, very small things, but very important things that anybody can do.
Well, I have one last question. It's
Okay.
a little more personal. What's the most fun activity you do with your family?
Oh boy. So I
Mm.
have I have 3 sons, and so, I think the one thing we do all the time is wrestle. There's a lot of wrestling in my house. So I think that's probably one of our most fun activities.
Hey, Senator Mann, it's Carla with AARP, and it looks like Courtney just popped off, but I'm glad you said that because I have 4 children at home as well, and we do a lot of that too.
Yeah. Very important.
It's important to have a little fun as well as as all the important stuff that we're working on here. Looks like Courtney is back. I'm going to add her to the stage.
It happens. What can we say? I heard I have 3 sons, and then it went away.
And I said we do a lot of wrestling, Courtney. There's a lot of wrestling in my house. Yeah.
I got it. Thank you for sharing that. Well, we did it. We actually had 11 questions
Wow.
in 10 minutes. I know. So thank you so much for taking time to talk with us today. We so appreciate your efforts in this on something that's so needed for everyone to make our society better. So thank you so much for your efforts.
Thanks for having me.
Appreciate it. Yes. And if you're watching, we need your help. Join AARP Minnesota in advocating for this critical state law by becoming an advocate at aarp.org/MN advocacy. You can also visit aarp.org/MN caregiving for more details on caregiving resources. Thank you to everyone for joining us today. Have a great day.